Deborah with Freedom Creators, and I'm doing a little video here because May is the Mental Health Awareness Month. And so we've been at Freedomwand doing all of our social media this month, focusing on the mental health through our, and the benefits of mental health and how when you can feel better about yourself, how that can help improve your patient outcome and heal you a lot faster. And so we would like to welcome Maria Lindbergh. She's an OT who created her own company, Stay at Home Solutions. And Maria is passionate about helping people stay independent in their homes, especially as it relates to toileting and wiping their bottom, which is usually a subject that people don't feel too comfortable talking about. But Maria, you and I are breaking down that barrier. So yeah. Good for you. Good for you. And we will post all of her links. So as she's talking, if you want to get back in touch with her or know more what she does, all of her links will be posted in our newsletter. So welcome, Maria. Thank you for talking with me today.
Oh, thank you so much for having me, Deb.
Why don't you tell us a little bit about yourself? How did you get started as a PT or an OT, I'm sorry, and what made you passionate about that, and especially the toileting part?
Yeah, absolutely. I'll try to make it short and sweet. So I was a caregiver for my grandparents, like around 19 or 20. And while I was helping them out in their house, it started off a little bit, just taking out the trash, changing light bulbs, those kinds of things. But it increasingly got more and more as they grew older. During that time, I became an occupational therapist, helping people with those daily activities that occupy their time, like toileting, going to the bathroom. And while I was having that professional experience and that personal experience, I noticed that the biggest barrier to people going home, or what seemed like the biggest barrier, was their bathroom setup, but also their ability to toilet, to wipe themselves, to pull their pants up and down, getting on and off the toilet, doing those things in the bathroom. And you're right, that is a topic that is so difficult for people to talk about. But I think as a therapist, I'm able to give people the space to have their feelings and to share them. And so I've worked with a lot of people in rehab and in nursing homes, the hospital, in the community. And I would have a lot of people cry. In particular, there's this woman, not her real name, but let's call her Linda. She had the worst knee surgery ever, where everything went wrong. She had an infection. She had a longer hospital stay. She grew weaker. She had more pain. So all of these things, even though she was young, in her, I think, late 50s, it made it more difficult for her to wipe herself. And so when I was working with her, she said, "I'm so sorry, I can't do it. I don't want to ask you. I'm glad you're here, but it's really embarrassing for me." And, was crying. So I worked with a lot of people like that. My own grandmother had urinary incontinence. And she had a lot of shame and embarrassment, not wanting to leave the house, go out in the community. So all of that experience made me want to help people with this problem, because it is something that is so difficult to talk about with your healthcare providers. I've shared that I've had issues too with hemorrhoids. And I didn't want to talk to my own doctor about it and I'm a healthcare provider. So I understand how difficult it can be to talk about it. So that's why I have an Instagram account at Hard Time Wiping. And I created a course called Hard Time Wiping, Let's Talk About It, for people who do have a hard time wiping. And I show different options, including personal hygiene wands like the Freedomwand, to help get that dignity back, get that privacy back in the bathroom, and clean yourself up on your own how you want it done.
Exactly. Yes, exactly. Well, thank you. It's amazing that you've got that intuition that you wanted to do that, and that you've got the strength of fortitude and continence on your part to, address it, because people don't like to address it and they don't feel comfortable. And so it's just kind of the elephant in the room that gets ignored. So wonderful. Yes. That's great for you. Well, we talked about confidence, independence, and maybe as a percentage, or maybe how would you describe when someone has the confidence to do their own toileting, how does that improve their outcome?
Oh my gosh. Well, it just makes people feel more like themselves. typically when people are having a hard time wiping, they're injured or they're going through some kind of illness, maybe even a chronic illness. And so there's a lot of things that feel outside of your control that you can't take care of yourself as well. Maybe there's things to do on the medical side or family side or your home. And that can really diminish your confidence and make you feel like, oh my gosh, I can't, here's another thing going wrong in my life. So to be able to take care of yourself and clean yourself up thoroughly how you want it to, using the kind of toilet paper you like, having that time alone in the bathroom, not having a healthcare provider or a family member helping you in the toilet. I recall I had somebody say to me, oh my gosh, if I'm not able to wipe myself, I'd just rather die.
Right.
It's just things like that. But to have that ability to figure out there's always a way to clean yourself up easier. It's going to look different from person to person. But for me, there's, I won't use that. I thought about this expression, but I know people don't like it, but there's a way to get it done. There's always a way to get it done so you can feel better about yourself. You don't, a lot of people feel like they smell bad or, because they're not thoroughly cleaning themselves. So taking care of yourself, it just really shoots that confidence through the roof. Like, yes, I've got this going right in my life.
Yes, I know. When I was in the hospital for 6 days with my broken back, I wasn't a fall risk. I had to push my IV pole. And so I wasn't really a fall risk. I didn't need help getting to and from the restroom, but I still needed to have somebody wipe, right? And it's like, seriously, if I could just do this by myself, we don't want people hearing what happens in the bathroom or smelling what happens in the bathroom.
Yes.
Some people say, well, my caregiver will come, well, you can schedule showers, you can schedule eating, you can't schedule toileting too well. It's a as needed type thing. Yes. And of course, water is really important. And I am very, very, bad about this, but if you don't want to take the time to go to the restroom or it's a pain, you just don't drink as much, right? And that's not healthy either. That creates UTIs all by itself with that kind of thing. So one of the things I'm wondering about is to introduce the toileting aid early on in their patient care while they're at the hospital. So like I said, I was there for 6 days, and most of the calls that I get, people are wanting to, they're getting it because they're going home. They want to make sure it's home when they get home. And I would like to help the staff and the people understand that having it while you're in the hospital, while you're in rehab, first of all, it's going to give you a great practice. But second of all, it's just going to increase your ability to be independent and give you more confidence that you can do this when you get home, right? Because I've had a lot of people say, I feel like I'm 2 years old. Yes. You get toilet trained at 2. And when your little one is toilet trained, you are so excited. You call grandma and grandma, they call grandma and grandma, everybody's, I did poopy in the toilet, right? So it's just so exciting to be independent. Well, when you can't do that again, you feel so deprived and useless because you can't even take care of that. And I've had that comment a lot with people that have called. So how do you, and also I'm wondering, do you feel it would help to have an adequate toileting aid to clean properly, to reach properly, to help with the UTIs? Can you see where that would be? What causes most UTIs?
Well, you brought up dehydration, and so it can come from people having urinary incontinence too. So the area being too wet, not cleaning your genitals thoroughly, your urethra. I also see it from people who wipe back to front. So especially for people with female anatomy, after they poop, wiping back to front, introducing that bacteria from your poop in your urethra also causes urinary tract infections. So it is so important to make sure after you go to the bathroom that you are thoroughly clean, taking the time. It can be so hard for people who can't reach, if you're having, whether it's because of a surgery, maybe you're plus sized, maybe it's arthritis, for whatever reason, if you're not able to clean yourself thoroughly, then you have these chronic urinary tract infections, which can lead to other infections, even sepsis. And you could go to the ICU because of a urinary tract infection. So yeah, it's very important to get cleaned up, to find a way to get cleaned up thoroughly so you can avoid staying out of the hospital.
Yeah, for sure. How about the BLT? No bending, lifting, and twisting, right? So I had the prescription, or whatever you might call that, of the no BLT, more than 90 degrees, right? I think, or more than 10 degrees. I'm not sure how they actually
More
say
than
it.
90. Yeah, yeah.
Yes. So of course, you know, people don't realize how much they bend. I never realized how much you bend to reach. And that when you are straight as a board, I mean, you are an L board and you cannot bend or twist, it is really difficult to reach yourself. And
Yes.
so, you know, I have used the analogy of, and so people think, well, I'm just going to overextend. Well, isn't that similar to if you have a no weight bearing broken ankle with, you know, the instructions of no weight bearing, and you put weight on that ankle, you're going to set your healing back. You're going to hurt yourself more. And that's the same as the BLT, isn't it? So when they overextend, overreach, twist, they're just setting their healing back. And that is not worth, you know, the small amount of money that you can buy a toileting aid for, and use it multiple times a day. You know, I've had people that have had the Freedomwand for 6 years. So you look at $40, $50, and you divide that by how many times a day times 6 years, it is pennies. It's worth it's worth the investment in a decent, good, high quality toileting aid to be independent with that kind of thing. And it will heal you faster.
Yes. Yeah. One of the rehab buildings I worked with, I was able to get them to stock Freedomwands. I don't know if they do it anymore, but, you know, going back to your point where it is so important to have Freedomwands, or, you know, whatever device you want to use to work with a patient for toileting, you want to teach them as soon as possible before they go home so that you can work out any kinks. You know, maybe you're having a hard time with this part, let's try changing it up a little bit. Having that is so important, especially when you are teaching somebody restrictions like no bending, no lifting, no twisting. It's no bending more than 90 degrees at the waist. And you're right, people, you know, if this is my head and, you know, my hips right here, people don't understand that you can't do that. And that is, I mean, for most of us, we all bend more than 90 degrees when we're reaching to wipe with toilet paper, you know, the traditional way. So it is, you don't, I tell people, I'm like, you don't want to do all the good work that surgeon did. Right. You know, you don't want to delay your healing. So yeah, it is so important to have equipment early on, training people so that you set them up for success when they go home.
And tell me about how it would help the staff. And I understand that the staff is there to help, but in this day and age, we all know that every single location is understaffed because of COVID and the new world, right? It's just a new world, and you just got to embrace that. But, you know, for myself, a patient like myself that was independent, getting back and forth, you know, I would have to go to the bathroom 6 times a day. That would be 6 call light buttons going off for the staff that they wouldn't have to answer. And I just think that that would be so beneficial for the staff to realize how much this would help the patient's relationship with the staff. It would help the patient feel more confident, but it would help the staff as well, not have to run after those call light buttons anymore. All the time. Now, I realize that some of the patients are a fall risk, so they still need to get to the bathroom and from the bathroom. But while they're sitting in the restroom, the nurse can be doing somebody across the hall or running, because they've got their call light button right by their toilet in the bathroom. So once they're there, they wouldn't have to wipe. They could just wait for them to be finished and then help them get back to their bed. And I just can see that as a huge blessing for, you know, the staff itself. Do you have any?
It definitely helps alleviate that.
Yes. We only have about a minute left, so it's been so fun talking to you, and I can't believe 15 minutes has gone by already. But do you have any stories that relate to toileting care? Or I know you shared the one named with Linda, but do you have any other stories you'd like to share, or anything else that would help improve patient outcomes?
Yes, absolutely. Well, I just want to share an anecdote that I used with the Freedomwand. So Sometimes I come across people using like steel salad tongs to wipe because they just don't know that there's other things that you can use to clean up your bottom after going to the bathroom. So I was able to help. She was a woman who was plus size. I won't say her name again, but she was plus size, so it's hard to reach around her belly to wipe. And I was able to show her how to use the Freedom Wand instead of using salad tongs. With salad tongs, it's not curved like the Freedom Wand. And plus, I was concerned about the edges of the tongs giving abrasions or scratches on her labia or vulva, or even the more sensitive tissue down there. So I was so glad to be able to switch that and help improve the quality of her life so that her skin would be intact and she would be thoroughly cleaned after going to the bathroom.
Oh, well, that's wonderful. I'm sure she was very grateful.
Yes, yeah. Much better.
Yeah, much better. Well, Maria, it was such a joy to be able to speak with you today. And thank you for coming on and all that you do to help people live a more active, independent lifestyle. We appreciate everything our OTs do every single day. So thank you so much.
And thank you for having me. And thank you for creating the Freedom Wand.
You are so welcome. And that will say goodbye, everybody.